Good afternoon, Miss. I am Micaela Maria Francesca Gomandana from BSPT2A, and my given situation is choking infant with parents and with bystander. So, my imagined situation, Miss, is I was walking in a restaurant, and while going towards my table, I passed by a couple with their baby, and I noticed that the baby had a bluish ring surrounding its mouth, and then the baby kept on moving but was not making any sound. And as a trained day responder, that would be a red flag for you, and you would come into a conclusion that maybe the baby was choking. So in this type of situation, what you can do first is check the scene. So this is to ensure your safety, check the scene whether it's safe to enter or not. So this is to ensure your safety, the safety of your patient, and as well as for you also to quickly identify the set of people who you can delegate tasks to. So after checking the scene is check the person immediately. But before going near the person is you have to ask for their consent first. And in this situation, I have to ask for the parents' consent. So I can introduce myself and then state my level of expertise. So I can say, hello mom, sir, my name is Mikay. I am a trained day responder. And I think your baby is choking. Is it okay if I go and help? So in this, if they have given their consent, I can immediately go and assess the baby. So after assessing the baby, I have to quickly decide, or while assessing the baby, I have to quickly decide whether it is a care first or call first type of situation. And in this situation, this is a care first situation since it involves respiratory problems. So I have to immediately provide care. So noted ni Miss nga mo provide na kog care and that mo delegate ko og task sa parents, like sila ang mo call for 911, like they have to state the kanang ako silang giingnan nga they have to state the location of the emergency, the nature of the emergency, the kanang phone number being used, description of what happened, and the type of care that I had given. And then for the bystander, I can task the bystander with kanang to look for immediate help or any kanang material that I would need sunod. And then so after ato kay one nag-provide, noted sad also Miss nga one nag-provide ko og first aid is nag-verbalize ko, and so madunggan sa parents and that ma-relay sa parents dito sa EMS dito sa call. So ang first aid Miss sa choking infant is that kanang akong i-pinch ang face sa baby with my thumb and my forefinger, and then like my rest of fingers can mag curl siya, and then my forearm mo assist sa body by nani. So I put the baby in a face down position like that, and then I can use my leg for support. So noted nga kani the baby's head should be lower than the chest, more naka-slant ni siya Miss. And then when I perform back blows, also naka-intact ako ang fingers to avoid hitting the baby's neck or the baby's head. So dapat ang base rest ako ang palm. So once naka-face down na position ang baby, I can perform back blows in between the baby's shoulder blades. So 1, 2, 3, 4, 5. So when you're done with your back blows, you can perform 5 chest thrusts. So with your hand, your forearm as a support sa body, cradle the baby and transfer it to your other hand and use your other leg for support. So you can perform chest thrust. So you can locate the area where you will perform by putting a finger in the nipple line, drop 2 fingers down. So ang depth na kung mag-chest thrust ka is that 1 1/2 inches. Noted nga put pressure but not too much nga to put na makaput na sa baby in danger. So 1, 2, 3, 4, 5. So you continue this cycle, 5 back blows and 5 chest thrust until the baby starts to breathe again, the EMS arrives, or when the baby becomes unconscious. And when the baby does become unconscious, you immediately switch to the unconscious choking infant procedure. So in this situation, mo na ni ang kaning important na mo na jud ka og EMS, but since nag-call naman ta, so it's okay. So what you will do Miss sa unconscious is carefully lay the baby down on a hard surface and perform 30 chest compressions. So again, how to locate is put a finger down sa nipple line and then drop 2 fingers below katong finger and perform 50 chest compressions. So in performing 30 chest compressions, kay noted that you have Noted that you have to wait for the chest to rise before following it with another chest thrust. So here, I will perform 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 13. So after doing 30 chest compressions, you follow it with 2 rescue breaths. So you do the head tilt chin maneuver. Check for any foreign objects. Open the mouth. Check for any foreign objects. And if wala, you're not allowed to do a blind sweep kaya it could push the object further and put the baby in more danger. So if wala, just continue on. So perform a kanang rescue breath. So 1, wala ni saka ang chest sa baby. So do the tilt again. 2, you notice nga wala gihapon mi kanang rise ang chest sa baby. So what you will do is perform 30 chest compressions again. So drop a finger sa nipple line and drop 2 fingers where you will perform your chest compressions. So once done with 30 chest compressions, you do the head tilt chin maneuver again. Check for any foreign objects, and that if naa, you can do a finger sweep. So how to do a finger sweep? Only if kanang makuha na siya, pwede rin makuha. Kanang, how you do the finger sweep is use your pinky and get the object in a hook-like manner. And once nakuha na, is perform 2 rescue breath. So 1, you notice na isaka ang chest sa baby. So to confirm this again, do the tilt again. 2, so you notice na isaka ang chest sa baby. So in this situation, this could go on in 2 ways. So what if wala ni breathe o giyaha ang baby or wala nag-show og signs of consciousness? So what you can do is repeat the cycle again until the EMS arrives or when the baby starts to gain consciousness and breathes again. So another situation is if ang baby starts to breathe again, is you can put the baby in a recovery position. So what you can do is cradle the baby in a side-lying position. So in this, what you will do na dayon is you wait for the EMS to arrive. So when the EMS does arrive, you provide any information, every information that you have gathered, the type of care that you have given, the basta everything that you know of Miss so far, and what you inform them of what has happened earlier and so on and so forth. So more to Miss. Thank you.